Will facial feminization surgery leave visible scars? The short answer is sometimes. But in this video, I'm showing you exactly what kind of scars to expect, where they show up, and how we keep them as invisible as possible. And I'm also sharing the advanced treatments that can take your healing even further. What types of FFS scars are there? So there are 3 types of FFS scars: visible, hidden, and invisible. So the most common that we'll use are what we call hidden scars. So anytime that we're working against the hairline, we're right against where your hairline is, but we have a technique called beveling where we can allow hair to grow back through the scar. They're invisible incisions. In my line of work, invisible incisions are through the mouth, and that is how we get to the cheek. That's how we get to the jawline, sometimes even underneath the jawline. All can be done from invisible incisions in through the mouth. Very rarely do we use a truly visible incision. Occasionally with a common tracheal shave or something where we're dealing with more in the neck than we want to, that's where a direct incision over the voice box itself is necessary. For most of my tracheal shave, I do what's called a submental incision far up underneath the chin, which essentially becomes a very well hidden scar. Where can FFS scars be located? So most common incision for facial feminization surgery is going to be up in the hairline. So the hairline incision or the forehead incision is how we get to the brow. It's how we get to the upper part of the forehead. That is going to be an incision that, if removing the hairline, is right against the junction of the hairline and the skin. That will also give us access to everything that lives underneath. And so where we place it is going to be right in the immature hair follicles that will help us hide the scar. Other areas are going to be, if we do a rhinoplasty, is I typically do what's called an open rhinoplasty, meaning that we make a very small incision across the bridge of the skin right underneath the nose. And then most things for the cheeks, so cheek augmentation, whether it's with fat or an implant, jawline contouring, genioplasty, buccal fat removal, lip repositioning, these are all done from inside of the mouth. The other is going to be what's called a submental incision, is how I typically get to the tracheal shape. That's if we're doing a neck lift or tightening up neck muscles, removing some neck soft tissue to improve support. Those are all done from an incision underneath the chin itself. How long do FFS incisions take to heal? FFS incisions, depending on their location, will take a variable amount of time to heal. For most patients, any hairline incision by the 3-week mark is going to be healed essentially fully, meaning that it is sealed from the outside environment. You can bathe, you can go underneath water. So that is what we consider a fully healed wound right at the 3-week mark for hairline. For underneath the nose, underneath the chin, the submental incision, those generally by the 2-week mark are fully healed. And then any internal or intraoral incision, usually after about a week, those are essentially fully healed. After that initial healing is the scar process takes hold. It's not something that we just leave alone. All of that is happening underneath the surface. So we will help you manipulate and create a more favorable scar, but the outside portions of the wounds are healed in that 3, 2, and 1 week timeline. What factors affect the appearance of FFS scars? Some of the factors that will affect an FFS scar include many patient factors. So age, sun damage, sun exposure, is there a history of acne? What is the overall nature and characteristic of your skin? How well do you take care of your skin? Have you done skincare for years or never applied any sunscreen? The other is, where do we need to place the scar? The anatomy of the individual have a very big impact on how visible a scar may be. Other factors include your general health, medications that you may take. These are all things that, as part of the consultation and workup process, we will identify and help you manage to get the most optimal scar outcome. How do you care for your scars after FFS? One of the things that we pride ourselves on is very heavy focus on post-operative care, and a big part of that is how we manage our scars. So we will always take you through a detailed review of, here's where my scar is, here's what I do with it. For hairline and forehead scars, those are generally, we leave them alone for about 3 weeks, other than putting bacitracin on their antibiotic ointment. Starting about somewhere right around the 4 to the 6-week mark is I will have you start massaging the scar. That will help make it a little bit softer. It will help feel like your forehead and the area of your hairline are moving more naturally against the underlying structures that are there. For upper eyelid scars, nasal scars, we don't really have to do much for those because they're very well hidden. They're very, very small, and they're in skin that is very favorable. So occasionally I will have somebody massage a nasal scar, but pretty few and far in between. The intraoral scars, I generally will have right around the 1-week mark, have patients start massaging them. And that's for 2 purposes. One is to push out some of the fluid. The other is just to prevent some of the fibrosis or the sticking down of the scar tissue. One of the most important areas is we do a lot of chin reshaping. And so when you do chin reshaping is you're going to adjust or have an impact on what's called the labiomental fold, the fold right underneath your lip. That we start massaging at the 2-week mark in order to prevent it from feeling tight, in order for it to prevent distorting your lip, whether you're moving it, eating it, speaking, that is a very important part of the process. And then with any submental or neck scars is right around the 2 to the 3 week mark, saying we'll have you start massaging it, helps flatten out the scar, make the scar feel smoother, helping the underlying and adjacent tissue feel much more natural and normal by putting some active massage on it. Generally somewhere between 6 weeks and 3 months for most scars is we will have you actually start doing formal skincare. That can range anywhere from when we have you put silicone strips on there. Help soften a scar, it can help decrease pigmentation, it can help it feel smoother, more linear, and decreases the overall fibrosis within the scar. Other things are scar creams. So scar creams, vitamin E lotion, vitamin E capsules, Mederma, any sort of commercially available scar care product is, I will recommend all of them because it's not necessarily the material that is most important, it's the habit of doing. And so if you commit to caring for my scar, it usually takes 1, 2, or 3 times a day where you have to apply something or massage something. And this is the way to get the best long-term scar. There are scars that we will sometimes do steroid injections, Botox injection, or there are even possibilities for surgical scar excision if we need to get a scar optimized. For all scar care, one of the most important things is sunscreen or cover. As the wound is healing, it's also very, very important as we will help you understand how do I clean my wound, how do I care for my wound in that immature phase, usually the first 1 to 4 weeks. But a lot of that is not picking at it, knowing how much can I manipulate it, having us help you manipulate the scar in order to keep it clean, keep it healthy, and allow it to maximize its healing potential.